Good afternoon. Good afternoon, everyone. Welcome to the Columbus Metropolitan Club. Wow, what an impressive crowd today. Is there a doctor in the house? Or a nurse? Is there a nurse in the house? Any healthcare professionals in the house? Very good. Thank you. Welcome all. Welcome all. So, guess what? Not so long ago, because for many of us, we were alive back in 1976. And for those of you who weren't, that's okay. We forgive you. In 1976, 13 visionary women came together to form CMC to connect people and ideas through community and conversation. So, yes, 1976 was a whole freaking 48 years ago. And 48 years later, that conversation and those conversations are still going strong. Yes, this year, 2024, the CMC is a whole 48 years of continuous community conversations. The CMC explores public policy issues, current events, and spotlights lessons in leadership at forums just like this one. Guess how often? Each and every week. Yes, you said it right. I heard one person in the back who was thinking about saying it. They just didn't, but that's okay. So from its very beginning, the CMC has welcomed everyone. And you know what we want to do today? Welcome everyone. Give yourselves a round of applause. Thank you for being here. And thank you also for the audience who is viewing live on our live stream and for those who might be watching in post-production. I'm Tony Bell. I'm the president and CEO of Phoenix Consulting Co. We design and facilitate coursework in leadership. So if you need some training for your people, you know who to call. I'm also proud to serve as a board member for your CMC Board of Trustees. For those of you joining us by live stream, we're coming to you today from our very beautiful home right here in Columbus's historic Italian village, the Ellis. It's a nice space. I love it here. So let's begin by welcoming the newest members of the CMC. Are you ready? There's two people that are not here. We're going to give them a round of applause. And I was looking through the audience trying to find these people, but it's such a robust crowd today. I didn't get it with the name tags. So let's welcome Parag Agrawal with Morpsey and Zach Woodruff with Columbus State Community College. Give them a round of applause. And I don't know, is it possible that Zach actually is here from Columbus State? No, the Columbus State table. Well, anyway, I'm a proud graduate of Columbus State and Capital and Harvard. So welcome to Columbus State. You gave me my start. And joining us in today's audience, feel free to stand up when I call your name. Gina Barikia, if you're here, with Gebin Communication. Jamie Squalente, with the Association of Independent Colleges and Universities of Ohio. Jamie, yay! Is that Jamie? Jamie or Gina? Okay. And then Courtney Thrayan from Central Ohio Healthcare Spectre Partnership. And I hope the camera was able to pan to those lovely human beings. And guess what? If you are not already a member, you have a red name tag on, and well, we want to work on that with you. It's so wonderful to be a member here. And no, you don't have to be a CEO, a CFO, a CIO, or any other O's. In fact, we'll just say, oh, welcome. Because CMC is open to everyone. Becoming a CMC member means that you play a key role in supporting civil discourse in Central Ohio. So please join. And it's easy. It's easy peasy lemon squeezy. For those of you who are members, would you agree? Easy peasy lemon squeezy to become a member. Just visit columbusmetroclub.org to join. And please do speak to a member of CMC staff while you're here today. We've got Mantra and Lainey and Doug and Sophia. and me, and we'll all be happy to help you become a member of CMC. And also, on your table, there is a QR code. You can see how many generous organizations support your nonprofit, Columbus Metropolitan Club, because we would not exist without their support. Thank you to the presenters of CMC's ongoing Optimal Health series. I love that it's a series because we get to hear from you again and again about issues that are important to all of us. And so those sponsors and presenters are, drum roll please, thank you. Nationwide Children's Hospital, ding, the Ohio State University Wexler Medical Center, and Ohio Health. Thank you to the many generous sponsors of today's forum: Epstein, Becker and Green, Mount Carmel Healthcare System, the Health Policy Institute of Ohio, the Center for Community Solutions, Cardinal Health, the Association of Independent Colleges and Universities of Ohio, and the Central Ohio Sector Partnership. Thank you to our gracious host, the Ellis, for this generous support. And we're also grateful, very, very grateful to the Center for Human Kindness at the Columbus Foundation and the Columbus Dispatch for presenting our live stream. It's being carried on right now. You're live on today's modern candid camera in the platform. And let's just thank everyone for being here at today's forum. Big round of applause. So today's forum is titled Prescription for Change, Solving Ohio's Healthcare Work Shortage. Few industries in Central Ohio can currently meet their present and future staffing needs. You know that. You go to restaurants, there's not enough servers, you're in a smaller space. You go to the grocery store, there's not enough cashiers. They put in automatic checkout. No matter what industry you go to, there's a worker shortage. But the one industry we cannot afford to be lacking in with workers is healthcare. Right? Because when you need help, you need it now, and we're looking for solutions. So certainly healthcare is among the hardest pressed in those sectors. And our healthcare giants are galloping to keep up with Central Ohio's growth, building new facilities. You've seen those facilities come up, and they will need to be staffed by a legion of trained professionals, including physicians, nurses, technicians, cleaning people, dietitians, everyone, because everyone in that healthcare system is important, right? Yeah. And as reported in the Columbus Business First, our major hospital systems are working to fill more than 2,200 vacant nursing positions right now. 2,200 vacant positions, and our population is continuing to grow. Rural Ohioans, too, are suffering from a lack of healthcare professionals with care deserts. There's food deserts, and did you know that there's also care deserts? Of course you did. You're a room full of healthcare people. But those care deserts leave whole counties without critical specialties. And today, we'll learn that what's being done to close that gap and to meet the needs of Ohio's healthcare professionals and patients like you and me. So to introduce our esteemed panel, please help me welcome Leanne Wallace, Chief Nursing Officer at Nationwide Children's Hospital. Leanne, welcome.
Thank you, Tony. It's an honor and a pleasure to be here today with this very incredible panel of healthcare leaders. I think all of us would agree that these are never before seen or experienced times for healthcare leadership. Workforce challenges that have included, I'm going to say these words that don't like shiver and shrink. Workforce challenges that included the Great Resignation, wage wars, staff leaving to go, you know that word, but we don't say it out loud. Post-pandemic fatigue, workplace violence, the list goes on. And this has resulted and continues to result, as Tony highlighted, ongoing difficulties just to maintain normal operations. Nationwide Children's experience these very same issues. And given the sold-out nature of today's event, I'm kind of sensing that you guys have experienced the same thing as well. What we all know is that our people are our most precious and valuable resource. So for us at Nationwide Children's Hospital, 2023 was a year of recovering, rebuilding, and reimagining to rebuild our bench. And we needed to rebuild the bench. You heard the nursing vacancies even now. But to rebuild that bench, we have had to reimagine how we can manage the talent pipeline. New strategies, new thoughts, new ways of doing things to manage the pipeline had to be reimagined. We've proactively developed innovative collaborations with many of the people sitting here on your panel to be able to attract and support new team members and maintain that pipeline. We've deepened partnerships with local and regional high schools, something we've not had to think about in the past, to highlight and to share with them and convince them why a career in healthcare might be something that they might be interested in. And we've had to have a laser-like focus on retention of this precious resource with an awareness that this new workforce has new and different needs and very different expectations than workforces that we have experienced in the past. So I'm looking forward to our conversations this afternoon, and I know you are too. And now it is my great honor to introduce today's distinguished panelist. So please help me welcome Dr. Todd Ambrosia, President of the Mount Carmel College of Nursing. Susan Boudry, Vice President of the Osteopathic Heritage Foundations. Dr. Karen Rose, Dean of The Ohio State University College of Nursing. And Dr. China Smith, Family Medicine Resident at the Ohio Health Dublin Methodist Hospital. And returning once again to host the Optimal Health Series, please welcome Greg Moody, Director of Professional Development at Ohio State's John Glenn College of Public Affairs. Greg, we're looking forward to great conversations.
Thank you, Leanne. Currently, more than 2 million Ohioans live in an area where only half the need for primary care is met. It's more than primary care doctors. Other shortages include dentists, nurse, home health aides, mental health care professionals. Our panel today represents doctors and nurses, but also consider this: more than 5 million Ohioans, nearly half the state's population, live in an area where less than 1/3 of mental health care needs are met. Healthcare worker shortages create gaps in vital services, leaving many Ohioans struggling to access essential care. Delayed diagnoses and treatment can worsen existing conditions and lead to poor health outcomes. Rural and underserved urban communities already facing limited access are hardest hit, widening the gap in health equity. Our panel today will focus on solutions, but to do that, we'll need to call out some of the realities behind the shortage: an aging population requiring more care, challenging work conditions, and widespread burnout, rising education costs, discouraging new entrants, daunting challenges. But our panel has dedicated themselves to tackling these issues, and I look forward to the conversation. So let's start. Please reintroduce yourself and share your frontline experience with healthcare worker shortages. What is the impact you've seen on workers and patients? Todd, do you want to start?
I'm Dr. Todd Ambrosia. I'm the president of Mount Carmel College of Nursing. I'm here all of about 10 months. I just relocated here from New York City last May. And challenges, yes, experienced in New York through COVID. I think that's where the pinnacle of the shortage began for me, and has been pervasive to the point of landing here at Mount Carmel and seeing that while the population is larger in New York, it's just as much of an impact here with the shortage at Mount Carmel. So yes, bringing a lot of experience, and hopefully some of the things we'll talk about today will have some impact.
Good afternoon, everyone. My name is Susan Boudry. I'm the Vice President of the Osteopathic Heritage Foundations. And I think I would start with about a decade ago, the foundation was aware of Ohio's impending primary care physician shortage. We also recognize the impact that that would have on patient care because primary care is so vital to a whole host of factors, including improved health outcomes, increased access to care, lower medical costs, and it even has implications on life expectancy by making sure that you have regular, consistent access to a primary care physician. So recognizing all of those factors and dilemma, we embarked on a partnership with Ohio University's Heritage College of Osteopathic Medicine. The goal was to provide students with exceptional medical school education and experience, but to also address that primary care physician shortage. We just received the most recent report reflecting that partnership. And as of today, in 2023, the graduates of the medical school at the Heritage College, 50% of those were placed or matched in primary care. And Ohio University's Heritage College of Osteopathic Medicine has become the largest private medical school in the state.
Hi, everyone. I'm Karen Rose, the Dean of OSU's College of Nursing. So I've been a nurse for a long time, longer than probably many of you have been living. But anyway, it's been a fabulous, fabulous career. I started clinically in coronary care, in taking care of patients who were trying to survive at that time, cardiovascular conditions. I've also worked in long-term care settings in nursing homes. And so I've worked really across the spectrum, if you will, of healthcare sites, and have seen firsthand really the devastation, if you will, of the impact of nursing shortages on nurses having the ability to provide the level of care that they desperately want to provide. So fast forward, and now here I am, a dean of a college of nursing, and I understand now what the pipeline looks like and why it looks like it does on the other end. There are pipeline issues from who we are seeking to admit into nursing school, to who we have as potential teachers, instructors, expert clinicians for these nursing students, to the impact of needing clinical sites for our students to be able to practice. And then certainly on the outer end too, this notion that, nurses, if you know one nurse, you might know one nurse. So nurses work at the bedside. Nurses are nurse scientists. Nurses may have provided you with anesthesia, a certified registered nurse anesthetist. Nurses are doing all kinds of roles. And so I think that one of the things, and we'll talk about this later, how you can help us is by really understanding it. And my role is to help people understand a little bit more about the breadth of nursing and what it takes and what it looks like to be a nurse. So I'm anxious to begin the conversation, and thank you.
Hello, everyone. My name is China Smith. I am a second-year family medicine resident at Ohio Health's Dublin Methodist program. I guess our question is, what does it look like now? And here in Columbus, we see the impact of primary care shortages in our program every day. Many of the Columbus primary care physicians are not accepting new patients, and our program is. So we see the more complex and more complicated patients who come in who need more support and more resources to keep them well and to get them well. So we see that shortage in primary care impacting the work we do every day. I think my perspective is a little different, and will add a nuance to the conversation in terms of being a part of the solution. So I sit here as a first-generation medical student, first-generation college graduate, participating in several pipeline programs to ensure that I made it to this seat here today. And it's important that we think both upstream and downstream in terms of the conversation with healthcare worker shortages. People that use their time, their talents, their treasures to help me get to where I am. That started in high school. and then support in college and support in medical school, and a program director that's here today supporting me so that I can participate in conversations like this. So some of it is short-term goals and some of it is long-term goals. So I'm excited to be on the panel here with you all today.
Thank you. Thank you. And China, let's stay with the conversation you introduced. You're all involved in education in some way. Are there enough students in the pipeline? How early do you start? Is cost and debt a deterrent? If you shift gears into the solutions you're pursuing to overcome those challenges, what's that conversation like?
So I think I have a couple perspectives, and it's going to be a fun time today. I'm really excited. One thing I want to start with is representation matters. So I didn't know this until I was much older, but both of my pediatricians were Black females. So growing up, there was never a doubt in my mind that I could be a doctor because my doctors looked like me. I didn't know my mom searched the whole county for the one Black female pediatrician. And when she moved away, searched again to find the second one. But the confidence that I have is because I never doubted. So the representation piece is super important. I think where we place our dollars and the programs that we support is also important in terms of pipelines. I participated in a pipeline program in high school where I was in the executive office and scrubbing in on surgery, standing there, not knowing what was going on, and helping in the foundation, like open heart surgery was the first time 15 years old, right? So I had experience, and how many people know it's not what you know, it's who you know, right? So I had the aptitude and the ability, but I didn't have the who you know. And participating in those pipeline programs gave me the who you know, so that when I needed letters of recommendation, it came from the CEO of that hospital because I was a high school student volunteering in his office. So wherever you work, right, in terms of shortages everywhere, there should be some little high school minions coming up behind you. You should have pipeline programs supporting the future generations. And that is so important here today. And even in medical school at Ohio University, I participated in their pipeline program to ensure that when I got to medical school, I had the tools and resources I needed to be successful.
Sure, I'll take it from here. So ditto, everything that you've said is true. And so what I want people to understand is that healthcare is a team sport. So as you know, there's no I in team. So I'm very concerned with getting enough people on the healthcare bus. And so you talk about getting people on the right bus and then in the right seat on the bus, right, as leaders. So I'm very concerned with getting enough with what the pipeline looks like for healthcare. Nurses, physicians, other therapists, we all work collaboratively as a team. So it really is something that I'm very concerned with, having students at a young age and people at an older age who are figuring out that they want to switch careers, to think about healthcare as an opportunity. So yes, we're doing all the kinds of things, looking at the pipeline from earlier and earlier. And I'd say to you that high school is too late. People are on a path in high school. So even earlier than that, I think we need to be very thoughtful and purposeful with introducing healthcare as a profession, and certainly nursing as a profession. The other thing I'd say is that then I need to look, and we're starting to very purposefully looking at who's in the healthcare pipeline right now. So who is a certified nursing assistant who might want to become an LPN? A licensed practical nurse. Who's a licensed practical nurse who, given the right bridge program and support, could become a registered nurse? Who's a registered nurse who might go on to become an advanced practice nurse, a nurse practitioner, or a nurse scientist, a PhD in nursing, who really is solving, these people are solving some of the most complex healthcare problems that we have. So I'm concerned about this entire pipeline, and I know we recently started and we'll have our first cohort this fall of a bridge program, the first in the state of Ohio, to take licensed practical nurses, and we purposely are recruiting from care deserts, federally qualified health centers across the state, for them to advance to become a registered nurse. So I think that it's a broader perspective, and I'm all in. It's a team effort, but I wanted to give you a sense of some of the different ways. It's not just looking at high school students. It's repurposing people and giving them opportunities to see a bigger place for them in the healthcare pipeline.
I would agree. On timeliness as well, starting sooner. I mean, we're in the elementary schools and the middle schools prior to high school, because I do believe high school's a great time to start to propagate the seed that's already been planted in elementary and middle school. As we look at programs like the bridge programs, LPN to RN and BSN and higher, I think we have to look at challenging our colleagues that are outside of the healthcare arena that are working with us every day in dietary and environmental services, and allowing them to understand the need in the healthcare arena, the patient provision arena of the healthcare environment, and help to manage upward mobility, professional development in programs like our second degree program, persons with other degrees to move into nursing for the first time, in their 40s and 50s, because the challenge is right now is understanding not only the shortage that occurs within nursing, but also the allied health professionals that are working alongside of us. Because if there are less of them to support us and resource us, and in return, there's going to be less of us as nurses and other professional healthcare providers. So I think it's an understanding of the greater picture of the dearth of healthcare providers and professionals. And I think that interchange, the understanding of what we need and when we need to start and how we engage and keep them engaged is very important.
I would just add a couple of thoughts, kind of building off of what China said. I know, for example, in addition to some of the high school age programs that Ohio University supports in terms of building that pipeline and encouraging new people to enter the field, there's been a recent partnership between the Heritage College of Osteopathic Medicine and ETSS here in Franklin County. ETSS serves the immigrant and refugee population, so trying to encourage and address that issue of representation and encouraging new Americans to consider healthcare as a profession and a field. I think there's also been some really exciting, as of late, new efforts. I'm thinking about Columbus State Community College and their effort to really shore up some of those kind of allied health professions that are essential to healthcare in a really innovative way and in a partnership with Ohio Health. And the goal within that program is over a 10-year period to really be able to double the amount of people participating in those programs and graduating with those degrees, but also having a lot of support along the way to make sure that people can stay in the programs, that it's not one life event, a flat tire, unexpected medical bill that derails somebody's career. So there's been some innovative thinking around what does the continuum support need to look like to really help people on their career pathway.
I want to say something, and it's going to ruffle some feathers, and it's going to be great. Because what we say often is not enough people going into the pipelines, and a part of that is true, yes. But there's also an issue with not having enough, and I think Karen touched on it briefly, not having enough care sites for nursing students to go to or medical students to go to, not having enough nurse teachers or preceptors for these students. So then at the beginning, people who would want to go into nursing or want to go into medical school are weaned out. It's kind of always been in medicine a wean out field where we have these super hard classes that have nothing to do with nothing, like organic chemistry and physics, that you might use one thing one time and then ask any doctor who's been out, they don't even remember any of it. And now you can just ask AI what the answer is. So some of those things like weed people out who would want to go into medicine or want to go into nursing and then no longer have the opportunity.
Picking up on what you're saying, getting them there is one thing, but keeping them in practice is another. And it's that retention after transition to practice. We're seeing huge challenges, as you know. And I think it's looking at the lived experience of that new nurse, at whatever point it might be, whether they're a new generalist nurse at the bedside or in advanced practice. How can we engage appropriately with them to keep them engaged, keep them with us longer? I think, Leanne, you would understand in terms of nurses coming in and you're challenged because they're working 3 or 4 months and they're leaving to go somewhere else. You ask them why. It's either more money or they're challenged because they don't have the right amount of resources. The nurses that they're working with or reporting to have less experience than those in the past in terms of those who are mentoring and leading new students and nurses transitioning into practice.
So on retention, let's go into some detail. There are 224,000 licensed registered nurses in Ohio, but only 130,000 are employed as an RN, about 60%. What happened to the other 40%? Is there an opportunity to alleviate shortages simply by improving work conditions and retaining qualified workers?
Yes. There. So absolutely. So I think the numbers can be a little deceiving as well. Some people who have retired still maintain an active license. So the notion is, how do we get some people back? And many people through COVID, registered nurses, chose another field. And so how can we bring them back? Are there opportunities to work remotely? Are there more part-time opportunities? Are there opportunities that we have in the education space where we could bring these people back, retool them, or re-educate, and really make them productive and really have them have a quality of work experience that they truly enjoy? So I think there are incredible opportunities to retain. I know that many of our partners, the Medical Center, Nationwide Children's, all of you are doing your darndest to continue to elevate nursing and healthcare at the bedside. I know that wages have increased and benefits have increased and all kinds of good things. And at the end of the day, what I understand, and data will support this, are that nurses leave the bedside because of the culture in an environment, that they can jump here or there and get another $1 an hour or whatever that is. And I'm not suggesting that wages aren't important, they are. And I'd suggest too that really opportunities of a mutual feeling of respect, that what the work that they do matters, is really incredibly important. And so I know that many times, as an example, grateful patients, I'll just bring that up, that grateful patients often come back to hospitals, healthcare environments, and say, the nursing care that I received here was awesome. What can I do? And too often times the answer is, nurses like chocolate and pizza. And I'd suggest that nurses also like opportunities to continue to learn and grow through continuing education, to travel to conferences, to have other opportunities to continue to lead in their organization. So I say that a little bit tongue in cheek, but I want people to know that there really is, we all win if we elevate healthcare providers. And I say that without, I won't get a dime of that, right? I will not get a dime of that. And that's okay. My role is to help elevate the profession of nursing. And if I can do that in some way, we all win.
Others?
To pick up on that as well, Karen, when you look at an environment and look at care models, how are we practicing healthcare at the bedside? Looking at a pilot that we have at Mount Carmel at Grove City, going back to that team nursing model, been investing the virtual nurse. So we've got the virtual nurse coming into the rooms virtually, and we also have the care team at the bedside, whether it's the provider, the multi-skilled technician, LPN, with the RN as well, and managing that care as a team, and looking at an elevation in morale and in those types of environments where you do have support and resources. But what can we do as well to pick up on that and maintain that? And to your point, make sure that there's professional development a genuine understanding of the nurse's lived experience at the bedside and attending to their needs and resources appropriately. I think it's constantly understanding that and changing with it as it changes, where we can be able to impact our retention and move forward through and bring nurses where we need them to be with us for a long time, doing what they do well to engage in patient care and community health.
I'm hearing culture and work conditions and supporting that, but I'm going to push a little bit on wages. You have a group of health systems here. Are wages important as it relates to addressing healthcare worker shortages?
Yes. All in favor? It is important. It's about livelihood. And when we do that, we humanize people. And I think most of these organizations are doing that. The problem when we talk about wages in medicine, especially with nursing, is one, nurses are a liability. So physicians are making money and nurses are not. And then in the grand scheme, we're talking about solutions here. In the grand scheme, it all needs to be fixed. It all needs to change. We spend more money in this country on healthcare than multiple other countries combined. So there's not like this, maybe there is, but like this extra money thing. But in terms of solution right here, right now, things like seniority incentives, when nurses are at Ohio Health, for instance, for longer than 2 years or 5 years, and then you don't have to float, or you get extra weekends off. Like some of these incentives that keep nurses when addressing the wages has already been done.
Me again? I'd say that, something that we haven't spoken about is debt, college debt, right? And so I think that the notion of that turns off a lot of students potentially from coming in. They, from the get-go, think, I can't afford this. Why do this? So I think we really need to look, and OSU and many others, we're addressing that through really trying to increase scholarships. Right now, the average debt for an undergraduate nursing student at OSU leaves with about $23,000 in debt. Many leave with nothing. So you can do the math, and we could debate if this is, higher education is a right or a privilege, given, what we know is going on in the world. But I think to the people that we've got to get real about that, and what is the public good? And what does that look like then on the other side? If people are willing to give up, I know that I've spent 10 years in nursing school, 10 years, going through my baccalaureate degree, a 2-year master's, and a 4-year PhD. And so, you accumulate debt along the way. And I think that I've certainly served my public well, but, this notion of how much and at what cost and the payback, I think we've got to get really serious. And I say that for my physician colleagues and other allied health workers as well. There's true debt incurred. And so we've got to get serious about what that should look like, and are there opportunities, other levers to pull to address that?
For medical students, the average debt after leaving medical school is over $200,000. It typically takes about 20 years to pay that off. If you're entering primary care, which is kind of the medical home for all of us, that is not as well compensated as if you were a specialized surgeon. So some of the things that we have been trying to do, and actually at the state level, we're trying to incentivize entering primary care by providing, once a person has been matched, providing a tuition scholarship to cover that year of medical school. The state of Ohio also has some loan forgiveness programs, particularly for individuals who are willing to serve in rural and urban underserved communities, but it's modest. You commit to 2 years, $25,000 in debt relief is provided. But if you're looking at $200,000, and mind you, that's the average. So we're seeing some students having as much as $400,000 in debt after completing medical school. $25,000 isn't enough to help with that.
Right. And there are challenges, I think, that right now with the student loan situation being so pervasive in the news, that it's challenging for a high school graduate to consider moving into a single focus school like Mount Carmel College of Nursing, with nursing being the aspect of, our existence there. But I think we have to consider those that are challenged and may not want to go into a 4-year degree. How do we approach them and engage them in college alternatives in the healthcare environment? So we're looking at building allied health programs that are intentional from the certificate level and help to bring students into an escalator approach into the health professions from the certificate through associate degree and higher degrees. And that is one way of engagement, because if we get them a certificate that gets them working as a professional, certified professional in the health system, oftentimes there's employer support for them to move forward into their higher degrees. And as well, engaging with our graduates and the health systems to look at loan repayment or a work repayment in terms of either additional wages or an opportunity for them to earn additional income to pay off their student loans and other expenses that they've incurred through their education.
Thank you. Well, we're now going to shift to questions from the audience. If you're here in person and have a question, please make your way to the microphone in the back. It's CMC's longstanding tradition to take audience questions. Mantra Moody is with us, and she's going to be curating questions from the live stream audience, which you can indicate in your chat if you're watching online. Mantra, what's our first question?
All right. Thank you, Greg. Okay, first question is from John Gregory. What thoughts do you have on how our local community will create alternative care models to address the home care staffing shortage in light of the number of persons who currently and in the future will need care?
Well, I think it touches on this pipeline question and how, and understanding that this is a long-term issue confronting Ohio and Ohio communities. I mentioned 10 years ago, we started working on this partnership with Ohio University's Heritage College of Osteopathic Medicine. I think some of these pipeline programs that we've talked about now are a step in that direction to try to address some of those shortages. But I think for often the wages earned by a home healthcare provider are so low, and there are so many other competing interests that we really have to look at both wages there in particular, but also ways to sort of think about incentivizing it so that it can be sustained, because we know that the population in Ohio is aging, and there will be more of us who need care at that level.
So I agree. It's a pipeline issue for sure. And I think there are numerous innovative models that have been tried elsewhere, and some are being tried right now in Columbus. Looking at volunteer opportunities for students to be paired with healthcare providers to provide some care. And then oftentimes, and I speak of this from my hat with as a gerontologist, to say that oftentimes older adults at home are lonely and they're socially isolated. And so helping, maybe leveraging some of our students, nursing students, social work students, psychology students, other healthcare provider students in colleges to be providing some in-home respite care. I helped with a model like this that's still going on in Virginia. So I think there are many opportunities. We have to think differently. Clearly, the way that we've been doing business as usual is not going to get us there. So again, I think that there are pipeline issues, and we really need to think very differently about who's providing care, what models providing care, and really be laser focused on what people need and what they want. not what we want for them.
And the home care environment is a challenging environment, especially for new nurses, not just home care, but community health nursing as well as long-term care. So it's engaging with nurses that want to work in these environments, but starting that in nursing school, not assuming that they have to spend a year at the bedside in a med-surg environment, but looking at an opportunity to resource that new nurse into the ambulatory care and home care environments, to resource those home care aides and professionals that are working with patients in their homes. I think that's another issue of engaging those individuals to stay in that field resourced and feeling like they have an opportunity to ask the questions that need to be answered when they're providing care in the home.
Thank you. Next question.
Hi, good afternoon. My name is Courtney Thrain, and I'm with the Workforce Development Board of Central Ohio that facilitates the Central Ohio Healthcare Sector Partnership. And I just really want to take a second to underscore the immense professional aptitude. We have 85 plus employees across 6 of the employers in this room today that are collectively working together to build trust with each other in relationships to deliver reasonable solutions and implementable initiatives to really work on building the talent pipeline with the youth, the adults that have, left high school, they aren't employed, and then also discussing these issues with, folks separating from healthcare due to retirement, et cetera. And the way that they did that, really underscoring the research, getting on the same page with the data, but then putting, the power in their arms to deliver employer-led program design models that can then be executed as deliverables. And they're working together on March 7th to host an event with 30 school districts in our region at the Columbus Convention Center. And they're doing those hands-on activities with the surge tech, with the rad tech, along with nursing, of course. And we're going to be alongside our education partners as well. But in thinking in these models and taking that example, having those relatable professionals there that look like the students, they're going to be at that event. What are your best practices in reaching adults maybe that have left high school, that are still trying to navigate their path, and identifying those folks? Because we'd love to have this event again next year, but have a day specifically for those individuals.
I think one aspect of it is meeting people where they are, and that answer is on social media. Like our residency program, for instance, our Instagram is live all the time. And people come to our program because they're like, wow, look at them. They're having fun. They're apple picking. They're out doing XYZ. So in terms of recruitment, you have to meet people where they are. And whether that is like your business profile or whatever, like having the strategy to meet people on the platforms that they're using, especially that population who is not as connected as those like fresh out of high school.
And I think providing immersive experiences to engage in open houses and other things where we invite interested learners to the college to come to our simulation center to visit and potentially look at shadowing experiences. We have a street medicine program and things of that nature that attract potential students into our second degree program.
Okay. This next question is from Wanda Dillard. She's asking, is there a way to change the policy for new Americans who train in their country and then when they come here, they have to retrain again?
So, okay. Is there a way? Yes. Am I in charge of that? No. So I know that we do in the United States have, cooperative agreements. We often, with the Philippines, as an example, for nurses. And so we have a cooperative agreement there. It's a sticky wicket, if you will, because essentially what we're doing is taking nurses from under-resourced places. I'm speaking of nurses, and bringing them to. So there's an equity issue always at play. And that's just the reality of it. I think that's a great question. I mean, what I'd love is for people to be trained here and for that not to be our major pipeline or a major pipeline. It is. And there are two sides to that coin, for sure. That's an entree in to the United States, and certainly they're providing amazing care for Americans. So I'm not going to rebuff that, and I think it's a larger issue than I can address anyway.
And I think that, it is an equity issue as well as an opportunity issue. Equity, making sure that they're on par with the nursing professionals, as I'm speaking for nursing as well, with nurses that are trained in this country, but also looking at opportunities to be sure that we could expedite that process a bit to get them evaluated and licensed and working where they need to be.
Me. Hi, I'm Charlie Bauer from Measurement Resources Company. Our organization just finished a year-long workforce study for the Ohio Department of Mental Health and Addiction Services, and everything you smart people said tracks. It's completely consistent across the space. We surveyed about 1,400 people, sort of from all parts of the pipeline, from working professionals to people who left, from high school students, college. An important part of the research was with career counselors, college advisors, other people doing the onboarding work. Their perception is low pay, high stress, burnout. Their perception wasn't Mount Carmel has this really cool program to pay for your advanced degrees as you go along, or there's an abundance of jobs in Ohio. So do you know if there's anything being done to address that part of the problem and pipeline? Thanks.
You may, Charlie, through the research that you all were doing, be aware of this program, but because there has been such a large number of the behavioral health workforce leaving the field, OMAS has introduced, it's called the Welcome Back campaign. And the intent is for people who have left the workforce being able to come back into a community-based health center or provider and have essentially a sign-on bonus to return. That sign-on bonus is $3,000, which, right now you can go to Honda and within a few months you can have a $5,000 or $6,000 sign-on bonus. So, and those issues of burnout, they haven't gone away. So I don't know other things that the state is doing right now to incentivize a return to work of those individuals beyond that particular program. I think the total dollar amount that's been allocated to it is fairly modest. It's sort of in some ways, I think it's testing to see how many people might actually return to work in the mental health and substance use disorder space. But it's being implemented at a modest level right now.
No, I don't have the solution to your question, and I don't know what the answer is, just to say that off the back. But when we talk about quality improvement and upstream and downstream and like how multifactorial addressing this problem is, I think it's important for all of us to think about the issue that is closest to us and how to reach that issue. So if somebody is in the education space, addressing the need for the counselors to present healthcare jobs as an attractive field to pursue would be something that you could be passionate about. Like if the fish are dying downstream, someone should give them the medicine, but someone should also upstream stop the poison getting into the lake. So whatever issue is closest to you is where we should put our effort and energy. And it's the same with people going into medicine. How many students of color and an advisor said, no, you could never be a doctor. And maybe they could have if they were encouraged to. So it is a problem and I have heard of it, but I don't know what the organized systemic solution is.
I'm getting a signal for one more question.
Hello, my name is Kirk Dickerson from Columbus State. I liked a lot of what the conversation was, especially about being able to create clinical sites and that pathway for, to higher education to fill some of these needs. One of the things that we're starting to see is that, our enrollment starting to turn the corner, but it's really about access. And especially due to the pandemic, we're seeing a lot of learning loss coming from the high schools and not due to no fault of their own. They had to deal with the pandemic. but that hasn't, that lengthens that timeline to be able to start your educational, educational program. I was wondering what responsibility or what do you think that the health sector and everybody in this room might be able to do to help with K-12 to be able to get those students college ready before they hit 17, 18 years old, so they're not having to take those developmental courses and that they're able to move into those programs quicker.
So I'll start. I think my mantra is kind of help us, help you. And I think that's Jerry Maguire, but nonetheless, I'd say that this is a team sport. And so I think, for today, let me give you an example. I took an Uber today to a location, and the woman who was driving from a historically underrepresented background, we just got to talking. Oh, you're at OSU. Yeah. What do you do? I'm in nursing, blah, blah. And well, her daughter would like to go in biology. I said, well, that's awesome. Would she consider nursing? So I think that we all have to be advocates. And I will tell you, people at the airport, would you like to be? And in fact, someone here today, I misunderstood and thought they were saying that they were leaving, but they said leading. And I said, would you like to be a nurse? And anyway, so I think that it's, and so this daughter, the Uber driver's daughter, said that, well, no. She wants to do clinical research. Oh my gosh, that's nursing. No one does more clinical research than nurses, right? So I think it's this notion of, please help us I think we've got to flip the switch, right? It's not doom and gloom and burnout and horrid. It's incredibly giving. It's incredibly, heart-provoking. It's an amazing career. And people were in all of the healthcare, physicians, anyone. And so really helping people see that there is a path, whether it's from being a community health worker, and if that's their path to move forward, whether it's an LPN and you can get that in high school, how do they move that forward? But I think too often people rely on Grey's Anatomy and gloom and doom, and that's not what we're about. So I think help us help you, and we all rise.
Well, I wish we had more time. It goes so fast, doesn't it? I am struck as we're wrapping up by the abundance of resources we have in our community. We have an abundance of expertise on our panel from our questioners, the people in this room. We have strong competitive health systems. We have a thriving health sector economy in our region. But those resources are not always distributed in ways that support the care that's needed in underserved and shortage areas. So what you all are doing to correct that, to address that, to work together to improve the health of our entire community, I applaud you for that. And with that.
Wow. Well, everyone, I hope that you found today's forum a team sport that you are part of. I think you know that not only are you a part of that team sport, but you play a really significant role in it. Certainly, I thought about pipelines and partnerships and the fact that you've been thinking about this problem for more than a decade, and it won't be solved overnight, but together we can all do it. And as Dr. China Smith reminded us, that it's not just what you know, it's not just who you know, it's who knows you. It's not just who knows you, it's who you know knows, and what who knows you knows about you. So we want to thank you so much. And if you want the phrase, you can talk to Sophia. She'll help you get it later. But am I right? Am I right? I am right. So thank you so much to the sponsors of our Optimal Health series, Nationwide Children's Hospital, the Ohio State. I know you guys are still reeling off that phrase. Want me to do it again? It's not just what you know, it's who you know. It's not just who you know, it's not just who knows you, it's who you know knows, and what who knows you knows about you. You're welcome. So again, thank you to Nationwide Children's Hospital, the Ohio State University Wexner Medical Center, and Ohio Health. And thank you to our generous sponsors for today's forum, Epstein, Becker and Green, Mount Carmel Health System, the Health Policy Institute of Ohio, the Center for Community Solutions, Cardinal Health, and the Association of Independent Colleges and Universities of Ohio. And finally, but last but not least, the Central Ohio Health Sector Partnership. We also want to thank the beautiful Ellis for this amazing space. Thank you to our seat patrons and the Center for Human Kindness at the Columbus Foundation and the Columbus Dispatch for presenting today's live stream. And a very special thank you and vote of appreciation to today's panelists, Dr. Todd Ambrosia. And everybody say, welcome to Ohio. Yeah, so glad we stole you. Please stay. Susan Beaudry, Dr. Karen Rose, Dr. China Smith, our introducer, Leanne Wallace, and our very, very thoughtful with this questions, thoughtful with this preparation, Greg Moody. Now remember, there's a Wednesday in every week. And so since there's one next week, there's another forum. And it's called, Is Public Art a Public Good? And it certainly is. I say yes. But we'll talk about why then. So thank you again, everyone. And we certainly could not do this without you. Have a great afternoon.
Stop.